There you are. Didn't work the first time. Hi.
How's it going?
Hi, Darren.
How you
How's it
doing?
going?
Sorry. Can you
How's
see
it
me
going there?
okay?
Can I hear you? Well, yeah, just okay. Hi, Darren. Welcome to my second live and your first live. I see lots of people joining us already. So yeah, something good to do on a Sunday evening. For those of you watching, and some of you will know, myself and Darren, we did our training together in Dublin, our initial acupuncture training. And Darren is in Dublin, and I'm here in Galway. Tell us a little bit about your practice, Darren.
How you doing, Helen? Thanks for having me. Just want to check, can you hear me okay?
You sound perfect now. There was a bit of
Yeah.
interference at the start.
On my end, I look pretty blurry. Is it okay your end?
Um, slightly. We won't worry too much about that. As long as people can hear us.
One second, sorry.
Okay.
There we go.
Better.
That's
That's
better.
better.
How you doing, Helen? Yeah, thanks for having me. I seen your first live last week. Where you were talking about motor points. That was great. Yeah, so thanks for having me. So yeah, I'm Darren O'Rourke. I run Physicare Integrated Health here in Artane in Dublin. We're kind of a mixed modality, multidisciplinary type of practice, but predominantly everything is acupuncture based. The foundation of what we do is based around neurophysiology and how we can reset the terms of the nervous system with the use of acupuncture.
Very good. Okay, very interesting. And I'm coming to you all from here from Galway. My clinic is AcuGlow Acupuncture Clinic. I'm right in the centre of Galway, and it was you, Darren, actually, that introduced me to motor points. I said, "Got to learn this," and from that I went on and did a lot more in the electroacupuncture. And I have to say, I'm very glad I did, because it really was a game changer. It's been really helpful to me and to my patients mainly as well. Yeah, just getting much better results in terms of clearing out pain, and we're getting so many people coming in with pain, and I like that. I know you're probably more focused on sports injuries in your clinic. Is that correct, or do you see more of a mix?
Yeah. I see quite a broad base of things, predominantly pain based, but I do work with a lot of high level athletes.
Yeah.
Good few pro, a lot of amateur that are trying to break through into the pro scene. So with those, although pain is something we work with, we're more so focusing on optimal performance and how we can help increase the output of the nervous system, the muscular system, to help them keep performing training at that highest level that they can.
Yeah, that's a really good point. And so members of the general public might be slower to come in for functional things or prevention, but it's, when they start to see that they can actually prevent flare-ups, or if they if they get like back pain once every few months when they just do that one movement wrong, and they could prevent all that with coming in for the in between, to keep the function correct, keep those muscles functioning correctly. So I was going to ask you, how do you explain electroacupuncture when you bring out the leads? And the response I got is, "Are you going to electrocute me now?" So what do you say?
Yeah, I just say yes. I'm going to
Yes.
hook you up to the mains, and that's it. You're going to be done. But
No pain.
seriously, no. I always explain everything that we're going to do before we do it. If there's a patient that is even struggling, mostly people struggle with the idea of a needle more so than anything else. So
True.
very often I'll deal myself just to show them it's very minimal, that there's not much to it. I'll explain why we're going to do what we're going to do, and it is mostly to do with kind of based around the structural system as well as the nervous system, how they both interact and work together. So I know you've done motor points, or you've done X-Star, Helen, so
Yeah.
you're familiar with how we test functional pattern to ensure that the body has stability.
Yeah.
I believe that from looking at the data and looking at people from through the years, dysfunction comes along before we have a pain experience. And this is where I kind of start educating the athletes that were coming in. So they began to not only come in, initially it was just for pain, but after that, leading up into competitions, we getting them in, we'll test them. They'll see areas of dysfunction. So we'll talk about how that will impact their performance, how it will impact their power, but for the general public, more importantly, how it will impact you later down the road when you go and pick your child up or pick your keys up off the floor and you put your back out.
Yeah.
One of the most common things we hear, probably on a daily basis.
A friend of mine, she put her back out by taking her inhaler. That was the final straw that broke the camel's back. So it just, you know, the dysfunction is sitting there latent, and then, you know, it can all go wrong. But so that's a really, it's good. And I always explain things as well to people, you know, to get the, you know, then they're on board as well, and they can
absolutely, yeah. I think
what's going on.
I think as therapists, an area, not just as acupuncturists, but right across the board with physiotherapists, osteos, chiros, you see people coming in, especially as acupuncturists. We're the final straw. We're their last chance.
Port of call, but that's slowly changing. I think we had been, but people are coming in more regularly.
Yeah, absolutely. Once we go through the assessment and through the history and take everything into account, and I'll explain things. And first thing I'll ask is, has anyone explained it to you? And 95% of people are saying no. Yeah. So education is a huge piece of the puzzle. And as clinicians, we're detectives. We're gathering that data. We're looking for the clues, the cues as to where we're going to devise our treatment plan and take that step by step in order to get that person back to recovery. That doesn't matter whether it's someone that has hurt himself 2 weeks ago or if it's someone that is in pain the last 20 years. Mm-hmm. We have to piece that puzzle back together in order to get them from that point, from this point to this point. Exactly. Put my hands out there without people.
Exactly. Yeah. I like that whole detective work thing as well that we get to do. Yeah, it's good.
Absolutely.
It's good. And it's definitely really rewarding, and you can make that huge difference for people as well.
Yeah. And so to come back to the electroacupuncture side of things, so once we go through that assessment, generally I will explain to someone how their nervous system functions. So the brain has both a sensory and a motor homunculus, and these are like the maps of the area that will control our body, our limbs. From if we touch something, we'll feel it. So that's the sensory side of things, and how we move and how all the little digits do what they do is through the motor cortex. If we have an injury or a downregulation of a part of the body, the feedback or the information coming from that part of the body up to the spinal cord and back to the brain it's not as optimal. It's misconstrued, so we're not getting full information back and forth. So the brain doesn't like that, and it sees that as possibly a threat to the system. So, excuse me. What the brain does then is, like, pain is, it's an output from the brain. So it's a message telling us that something isn't right. It's not always a correspondence to tissue injury or tissue health, but it's a warning system that is telling us something's wrong with that area, and generally the brain will try and downregulate to limit the use of, whether it's you roll your ankle, to limit the use of that foot to protect it from further damage. So what we have to do as therapists is return the state and function of the surrounding tissues of that joint back to optimal function in order to stabilize the joint. And from everything I've done, what I see, and from the research as well, shows that electroacupuncture is really the most optimal way of doing that, because we can both reduce pain through the pain relief mechanisms of acupuncture, but we can also get those tissues and nerves back firing to stabilize that joint.
Yeah.
So that's kind of the way I explain it. Please excuse me, I'm a little bit nervous. It's my first time doing it live, so
Don't worry, you're doing
my,
fine. That's
my
a really
language may not be great.
That's a really
and a
good
little
explanation. I would just add as well, I like to use the spinal segmental sort of theories. It's a kind of a quick explanation. I just say, oh, those nerve fibers, they come up to the dorsal horn of the spine, this come to each spinal segment,
yeah,
and then you get the down regulation there, and that's been shown scientifically as well. And we, point to that evidence, and it's all about evidence as well.
absolutely.
People want to see evidence.
Yeah,
People want to see like black and white research. It's there in black and white, and that's it's always good to have that backing as well. We know it works, but we want to know that there's evidence based theory as well with it.
absolutely. And the research is getting better. The data is actually improving, and the more research we are having done, the better we're seeing the results.
Absolutely.
So and that's where you're starting to see everybody, whether there's MDs around the corner for me that is now providing acupuncture to their patients, and there's other MDs referring their patients down to me. So
it's the same here. And I was recently on that webinar, and with the other acupuncturists, and they had some doctors on who were incorporating it into their practice as well. But they were always talking about the research, and I think the main thing that helped our research become better was that we're comparing it to usual care now instead of comparing it to sham acupuncture, because you can't really do sham acupuncture, can't put a needle in the body and not get some kind of physiological response. So once they changed away from trying to do that, you could really see evidence, and you could say, oh well, maybe in this case physio will work better, maybe in this case exercise, maybe it's a combination of these, and and that's better for the patient as well as being able to provide a really good comparison. Do steroids help in chronic pain? No, they're not recommended anymore. And then using these guidelines as well, the comparison.
And absolutely, I think that is the key principle. I think we should be providing a combination of these things and working together with other therapists and practitioners as a patient-centered focus, as opposed to comparing one to the other. If there's a benefit of, let's, as an example, just use a 100% figure. If one therapy has a benefit of 50% for the average person, another has 20, the other has 30. Let's combine all three and get the person
100%
better as quick as possible and back functioning in society.
I'm finding now, people will come in more often as well. Like, do you want to wait 6 weeks to get better, or do you want to be better in 2 weeks? And they'll come in more often, especially if it's bothering them, it's getting in the way of their life, and their their hobbies, their sports. There's
definitely. And we see the improvements so much quicker if somebody comes in more frequently. And generally the way I would explain that to someone is, well, if you go to the gym and you want to work out and you want to put a bit of mass on, you need to go multiple times per week.
Exactly.
We're working with the same nerves, we're working with the same muscles, we're working with the same blood vessels. Let's get you back as quick as possible, as opposed to dragging it down the road.
Absolutely. So I think you have an announcement as well. Well, something to come in the future. Just let the cat out of the bag. This will be one for the acupuncture.
I've been really enjoying helping out the Chinese Medicine That Works crew and Anthony Lombardi. I've been assisting them for a good while over in the States and Canada and even over here in Ireland. But as things have changed over the last year and a bit, just with travel restrictions and a bit more time now, not really more time, because the clinic has been absolutely booming. Like, probably grown by 40% since the beginning of the pandemic.
We're in need.
It's been but what that's done is it's really highlighted the need for what we do to be done by more people.
100%.
So I'm hoping, fingers crossed, we're gonna, if things get open back up this year, I'll hopefully have a class on by the end of this year with electroacupuncture, with including of motor points, some soft tissue work and assessment. based techniques.
That's really great news. And you've been working alongside Anthony Lombardi, and Anthony Lombardi is a really great teacher. He has tons of
Oh, it's
experience.
fantastic.
So that's been, yeah. So if you can share along some of that and some of your more, you'll have loads of clinical experience as well because you're doing this every day. So yeah, that'll be really great, and it'll be a valuable start off point for acupuncturists in Ireland. They're starting to find out more, because it was 3 years ago actually when I first trained with Anthony and with Rich, and I've done a lot more since. I actually did a lot more trainings with Rich. It was myself, and then you've been doing a lot more with Anthony, and you came to Paris that time as well. So yeah, did a lot that first year, and I was very fortunate to go over to New York to the guys. I went over and we did the 3-day. And so it was great. And Dan Dominguez had all the protocols he uses on the football team and things like that as well.
On the Buffaloes.
On the Buffaloes.
Rich and Dan they're amazing. They're great at what they do. It's like they're such nice guys. And Dan has had a phenomenal career. Like, he's kind of been leading the way in the States. He's one of the first to go into a medical university treatment, and now he's the first to go to the Buffalo Bills, so it's the American Football League. So like, it's what he's doing is absolutely phenomenal.
It is.
He's kind of paving the way for the rest of us to follow along, which is great.
For sure, and we're very lucky. We're very lucky to know him as well, and to benefit from all that expertise, for sure. I think we have put loads of information out there, and I think we didn't get lots of questions, but I'll just say that if people want to send in any more questions, and if they still had more questions about acupuncture, electroacupuncture, what kind of things it can treat, you can just send myself or Darren a message, and we can answer them in stories or in a future post as well. That's been great. So I'm going to end the live now, and I'll post it up on IGTV for anyone coming along later to have a look as well. All right.
Excellent.
Thanks, Darren.
Thanks very much.
Have a good evening.